Imagine your baby suddenly seems unable to feed properly, looks weak, cries softly, and feels unusually floppy in your arms. You feel scared, confused, and desperate to know what is happening. This situation can be terrifying for any parent. But there is a condition called infant botulism that every parent and caregiver should understand. Knowing what it is, how it happens, and how to identify the early warning signs could save your baby's life. In this video, we will explore everything you need to know about infant botulism, its causes, symptoms, treatment, and most importantly, how you can prevent it. Please stay with us until the end, because the information we are going to share could truly make a difference for your little one as safety and health. Infant botulism is a rare but serious illness that affects babies, especially those younger than 1 year old. It is caused by a bacterium called Clostridium botulinum. This bacterium produces a powerful toxin that affects the nerves and can lead to muscle weakness or even paralysis if not treated in time. Unlike adults, babies do not get sick from eating food that already has the toxin. Instead, they become ill when they swallow the spores of this bacterium. Once inside their immature digestive system, the spores grow, multiply, and start to produce the dangerous toxin directly inside their body. Because an infant's gut and immune system are still developing, it cannot fight off the bacteria as effectively as an adult's body can. That is why this condition happens almost exclusively in babies under 1 year of age, especially under 6 months old. Now let us talk about how babies get exposed to these bacterial spores. The main cause of infant botulism is swallowing spores of Clostridium botulinum that exist naturally in the environment. These spores are found in dust, soil, and even on surfaces around us. They are harmless to older children and adults, but for a baby, they can be dangerous. The most well-known source of these spores is honey. Studies have shown that honey can sometimes contain Clostridium botulinum spores, even if it looks perfectly clean and natural. That is why experts and doctors strongly warn against giving honey to infants under 1 year of age. Not even a small spoonful, not even baked or mixed in food. Other possible sources include exposure to soil and dust, especially in areas where the spores are present. Sometimes the exact source is never identified, but what matters is understanding that the risk is higher in young babies. Around 95% of infant botulism cases occur in babies younger than 6 months. So the best prevention step is simple. Never give honey to your baby. Avoid exposing them to dusty or dirty environments as much as possible. And always keep their feeding utensils and bottles clean. Now let us look at how to recognize the symptoms. The signs of infant botulism can develop slowly and may seem mild at first. But they can progress over time, so it is very important to observe your baby carefully. One of the earliest signs is constipation. Parents may notice that the baby has not had a bowel movement for several days, which is unusual for them. Another early sign is poor feeding. The baby may have trouble sucking or swallowing milk and may seem tired or uninterested during feeding. As the toxin affects the nerves and muscles, the baby may start to appear weak or floppy. Their arms, legs, and neck may feel limp when you pick them up. You might notice drooping eyelids, weak crying, or a blank facial expression. Sometimes the baby appears alert but does not have the normal muscle control. They might also have difficulty breathing or controlling their head movements. What makes this condition tricky is that the baby usually does not have a fever, so parents might not realize something serious is happening. If you notice any combination of these symptoms, constipation, poor feeding, weak cry, droopy eyelids, or general weakness, you should contact your doctor immediately. Early diagnosis and treatment can make a huge difference. When doctors suspect infant botulism, they will first do a complete physical examination and check the baby's muscle strength, reflexes, and feeding ability. They might order stool tests to confirm the presence of the toxin or bacteria. However, because this condition can become dangerous very quickly, doctors often begin treatment even before test results come back. The earlier the treatment starts, the better the outcome for the baby. The main treatment for infant botulism is a special medicine called botulism immune globulin, also known as baby BIG. This medicine works by neutralizing the toxin in the baby's body, preventing it from causing further damage. It is given through an intravenous line directly into the bloodstream. In most cases, babies who receive this treatment recover well and regain their strength over time. The survival rate for treated infants is very high, almost 100%. However, the baby might still need to stay in the hospital for a few days or weeks so that doctors can monitor breathing, feeding, and muscle strength. It is important to note that antibiotics are usually not recommended for infant botulism. When antibiotics kill the bacteria, more toxin can be released into the bloodstream, which might make symptoms worse. Doctors may only use antibiotics if there is another separate infection. During recovery, some babies might also need physical therapy or special feeding support to help them regain muscle strength. The recovery process can take time, but most babies eventually return to full health. Now let us discuss prevention, because prevention is always better than treatment. There are a few simple steps every parent can follow to reduce the risk of infant botulism. First and foremost, never give honey or any food containing honey to a baby under 1 year old. This is the most important and easiest way to prevent the disease. Secondly, try to minimize your baby's exposure to dust and soil, especially if you live in a dry or windy area. Keep your home clean and wash feeding bottles and pacifiers thoroughly. When your baby starts crawling or spending more time on the floor, make sure their play area is clean. Also, pay attention to your baby's feeding habits, energy levels, and bowel movements. You know your baby better than anyone else, so if you notice something unusual, like difficulty feeding, constipation, or a weak cry, trust your instincts and talk to your doctor. Remember, early action can save your baby's life. To summarize everything we have learned, infant botulism is a rare but serious condition caused by bacteria that produce a nerve toxin inside a baby's intestines. It usually affects babies under 1 year old, especially those under 6 months. The main cause is swallowing bacterial spores from contaminated honey or dust. The symptoms include constipation, weak crying, trouble feeding, droopy eyelids, and general muscle weakness. It is treated with a special antitoxin called Baby BIG, and most babies recover completely when they receive medical help in time. So as a caring parent or guardian, your main focus should be prevention and awareness. Avoid giving honey, keep your baby's environment clean, and stay alert to any changes in their health. If you found this video helpful, please take a moment to give it a thumbs up. Subscribe to our channel and press the notification bell, so you do not miss future videos that can help you keep your baby healthy and safe. If you have any questions or experiences you would like to share, please write them in the comment section below. We always appreciate your thoughts and support. Thank you for watching. Take good care of your little one. And remember, being informed is the best way to protect your child's health.